I am Aliza Rashid, a student of 4th year MBBS from King Edward Medical University. Today, I am going to talk about epilepsy. Epilepsy is a group of non-communicable neurological disorder characterized by unpredictable recurrent seizure. There is abnormal electrical discharge in neurons. There should be a balance between excitatory and inhibitory neurons for normal brain function. In epilepsy, there is upregulation of excitation and downregulation of inhibition, causing most of neurons to fire synchronously. Symptoms would be loss of awareness, unusual behavior or sensation, uncontrollable movements, and loss of consciousness.
There are many conditions can cause seizures, including something abnormal in the brain, for example, tumor, stroke. But some people's seizures is because of tiredness, not enough sleeps, or not enough sugar or salt in the blood. Whereas some people are genetically predisposed to develop seizures and they have family histories, and seizures occur among some of the members in their family. However, this is not common.
To prevent seizure, one should have healthy, balanced diet which is high in fat and low in carbohydrates, called as ketogenic diet. It produces ketone bodies which is then used by the brain as energy instead of glucose. Be physically active. Avoid activities like swimming or driving which can lead to problems. Avoid alcohol because it can act on the GABA receptors in the brain and make epilepsy medication less effective. Avoid smoking because it exposes your brain to certain chemicals found in cigarette such as nicotine and arsenic. Smoker had 1.46 times higher chance of epilepsy than non-smokers. Follow your doctor prescription. Epilepsy is a chronic condition and needs long-term treatment and needs follow-up. After being diagnosed, it is often treated with daily medication. Primary form being anticonvulsant, there are a wide variety of options that has different targets in the brain. Other treatment include epilepsy surgery where the cause of seizure has been removed.
The purpose of my talk is really just to increase awareness among the community that epilepsy is a disease that can develop later in life, not just in the pediatric population. The incidence of epilepsy is actually highest in patients above the age of 75. So as patients get older and as life expectancy increases, more and more patients are going to be at risk for developing epilepsy. And it's important that we identify that early in order to increase awareness, to reduce ER visits, and improve access to care.
So how do you identify people in the older population with epilepsy?
You know, that's a very challenging task. Unlike children, adults, particularly those who are older, tend to be living independently. They're not monitored 100% of the time. Sometimes they may have spells that they're not sure what's going on and they don't think that it is actually a seizure. So it's important to actually educate the patients, but also their primary care physicians, the frontline doctors, that anytime somebody has recurrent events that are classic and easily described, that are recurrent, these are the things that we have to look out for in order to identify epilepsy in an adult population.
Epilepsy is a condition that can negatively impact patients' quality of life and become very dangerous. Patient education is very important so that patients stay adherent to pharmaceutical products preventing seizure recurrence.